The verdict of medical misadventure at the inquest into the death of 16-year-old Aoife Johnston at UHL has renewed focus on the hospital's emergency department.
It's terrifying. I'd be terrified to go in there myself, or if my own other children had to go in again. And that's really a sad state of affairs.
No, they need to get on with it and sort it out.
Yeah.
More people are going to die in that hospital.
Yeah.
1,000,000%. They need to sort it out.
Aoife's parents, Carol and James, both calling for change. This morning, 106 people are waiting on trolleys in UHL, according to the Irish Nurses and Midwives Organisation, more than double the number in the next busiest hospital in Galway. Across the Midwest, there are calls for a reopening of emergency departments in Ennis and Nina. The Tánaiste says the situation should be reviewed.
There should be a review of the entire region. Given the level of failure within the University Hospital Limerick, I think it is fair, I think, for people to ask for a review of that. We should do that. Obviously, the clinical advice will have to input into that, but there has to be a response to what has happened.
UHL and the HSE have pointed to change, including the hiring of more staff and the building of extra beds, with the Health Services Chief Executive accepting that there is a lot of work to be done. Yesterday's inquest evidence by emergency consultant Dr. James Gray rings loudly. He described the emergency department as a death trap. In his view, the plans don't go far enough and it will continue to be dangerous. The confidence of 425,000 people across Limerick and the Midwest in their healthcare system depends on major and rapid changes. Richard Chambers, Virgin Media News.